Welcome back, everyone. We are going to pick up where we left off. We are going to start on sheet 3 of the intraoperative nursing record.
Before we do the skin prep, we need to check the patient's skin condition and document.
What are we looking for?
We are making sure there are not any skin irregularities before and after the application of the skin prep, as well as allergies. If the patient is allergic to shellfish, it may be smart to not use betadine.
So, we check his previous records for this information?
Yes, you want to eliminate the chances of a reaction.
Since he is not allergic to shellfish, we are going to use the betadine paint and scrub and document the skin integrity after it is applied.
While you are at the car, can you grab the medication we are going to use? It should be in a bag. There's lisinopril 10 mg, Omincef 500 mg, and Prevacid 30 mg should be given to the patient preoperatively.
The lisinopril is for high blood pressure?
Yes, it looks like Cincinnati State has taught you a bit about pharmacology too.
They try to make us real-world ready.
Omincef is an antibiotic, right?
Correct. And the Prevacid is for nausea.
Yes. We want the patient's vitals to be correct and them to be at ease before and after the operation. Can you grab the sterile solution from the central core in the warmer? It's the 9% NaCl solution, and read it to the surgical technician.
Yes, of course.
Since we are doing a urine sample, we are going to need a straight catheter to make sure that the patient doesn't have a urinary tract infection. This is something that the Christ Hospital requires to make sure the patient did not come in with an infection during the surgery. We are going to need to get a specimen sample of the patient's gallstones. Please get a dry container so that we can label it for the pathology.
We'll also need to fill in the surgical pathology form to send with the specimens, right?
Yes, once the specimens are handed off the field, labeled and double-bagged, we will put the pathology form inside the bag and take it to the central desk after the procedure.
We have no implants or explants, so we would put not applicable on the documentation.
Dr. Philgood requested a Jackson Pratt Grenade 150 for drainage. Notice that came in the case card with the other supplies for the procedure.
Considering what I have learned, would we need a Band-Aid for the small incision, as well as steri strips and dressing sponges, as well as Tagaderm with paper tape for the large incision?
Yes, especially the paper tape, considering it gives the least amount of reaction to the patient's skin.
Now that the surgery is over and the patient is coming out from being under, what do we do?
We safely transfer the patient to the stretcher and transport him to PACU.
Who transports the patient?
Usually the circulator and anesthesiologist walk the patient there.
Is there anything we need to take with us?
Good question. Sometimes the surgeon will have ordered a prescription that they want the patient to have after they leave the hospital.
So, let me grab that to take along with us.
Yes, the script, and make sure we have the chart with all the updates on the green sheet.
Once we get to PACU, what will happen?
The RN in PACU will tell us which unit to place the stretcher. We will then tell the nurse the patient's name, date of birth, the procedure that was performed, the anesthesia that was used, meds that were given through the IV, the dressings used, and if there was any complications during the procedure.
We leave the prescription with the RN?
Yes. And they will see to it that the patient or the person with the patient will take it home.
How long will the patient stay in PACU?
It depends on the patient and the procedure that was performed. PACU is looking to have all the vitals come back to pre-op levels.
What is being monitored while the patient is in the PACU?
They are watching the patient's blood pressure, pulse, blood oxygen level, and post-op pain management.
Is the family allowed to come back to see the patient now?
Due to other patients' privacy, they try to keep family from coming back to the PACU.
After the PACU, where does the patient go?
They are usually either released to go home or they are admitted to stay the night in the hospital.
Wow. That is a lot of things that you have to document. It was basically everything we did from start to finish for the procedure.
You are correct. We want the most complete record for the patient and hospital.
Thank you so much for all your help today. I learned a lot about documentation.